We've been doing these Saturday afternoon COVID updates. We had a little bit of technical difficulty, and as we all know, all of us who are dealing with Zoom and every other kind of virtual device right now, it's been a challenge sometimes just to make sure you're able to get on and get everybody convened in this virtual way. So we thank you. Those of you who have been here before know we were not here last Saturday. I think that was only the second time in the last few months that we took a Saturday off, so to speak. But there wasn't a particular reason for that. It was just a scheduling issue, so we're back here. And if you haven't been here before to this COVID-19 town hall, it's very typical for us to have a special guest. And before I introduce our special guest today, let me just say a few words about what's transpired over the last couple of weeks that we know of in terms of county and state information around COVID-19 and the pandemic. Again, I'm Santa Clara County Supervisor Dave Cortese, and one of the things that we've been tracking very closely is the fact that, as many of you know, there was some kind of a glitch in the computer data system at the state level, which is different than our tabulations and our data at the county level, but it has created problems in us giving you the kind of information that we have been giving you normally on a day-by-day, hour-by-hour basis in terms of number of infections, number of deaths, other indicators in terms of how we're doing. A lot of that has been sort of mixed up or delayed the last several days because of a state computer glitch. That glitch has been fixed. They are catching up with the backlog, and so some of the data they tabulate for us is going to be coming out now pretty rapidly. Check into our email updates if you get those. If you don't, you can contact my office at 408-299-5030, and we can get you on the list for what are usually daily COVID-19 email updates. Plus, there's a dashboard on the county website. If you go to sccgov.org, that's the main county website, up on the screen you should be able to see the website for the Public Health Department and the dashboards there. And as those are updated, you can get that information literally by the hour. What we do know is as of August 14th, we had 13,856 positives. That is the correct number, notwithstanding the fact that we have a backlog. But the number that I focus on sometimes, I'm sure in some sense people are a little tired of hearing it, but we do it both with respect to the families and the grief that's out there, but also as an indicator of how we're doing. 208 deaths, an increase of 17 in 2 weeks. Now, you may recall that just 5 or 6 weeks ago, we were reporting to you that we were having 1 to 2 deaths per week in this county. We had gotten away from double-digit figures, and everyone was pretty happy about that, feeling like this thing is getting under control. And then we started to get a surge. Things started going in the wrong direction. Hospitalizations started to increase, and those death numbers, unfortunately, have increased. Hospitalizations, by the way, are at 176. That is a number that we keep track of here locally, not at the state level. But that's actually a decrease over the last 2 weeks. So some mixed messages there, but overall this county continues to do much better than a lot of urban counties in the state of California, particularly in Southern California. And of course, we're doing better than a lot of places in the rest of the country. And I think that's thanks to people like all of you who are listening or watching today, doing the right thing, wearing masks. We are going to probably take these masks off in just a minute after I introduce our special guest, because we are distanced here. We have a very small crew that is 6 feet apart or more, including our guest today, and that's how we'll continue. One of the things I do want to talk about very briefly is last Tuesday, the Board of Supervisors approved new enforcement measures, civil penalties, not criminal penalties, but civil penalties, that civil officers in the County of Santa Clara will use now to write citations if people are creating problems with non-compliance, whether it's not wearing masks, whether it's challenging shop owners or restaurant owners by going in and occupying space and not doing the right things and not distancing. And in some cases, there's even penalties there for large institutions if they're not doing the right thing, like testing. So if you want more information on that, again, contact my office and we can connect you with all the facts and figures. Now for the introduction to the person that's going to be here today answering questions specifically about education. She has been County Superintendent of Schools since February 2018. She joined Santa Clara County Office of Education in 2013 and has also served as Chief Schools Officer and Deputy Superintendent. And I've had the opportunity to work with her off and on that entire time on many policy issues. It's been no surprise to me that she's been a terrific County Superintendent of Schools, and we have really accelerated our efforts to work with her at the County of Santa Clara. In fact, we just negotiated a $7.1 million investment by the Board of Supervisors to match some other money and to get that in the hands of the county, of the Santa Clara County Office of Education, so that they can close the digital divide, bring devices to about 15,000 students in the county who were left out of online learning because they just couldn't hook up. So she will talk about that some more, I'm sure. And I want you to give a nice virtual welcome to, again, our very special guest, Dr. Marianne Dewan, our County Superintendent of Schools. And maybe you want to make a few more comments in terms of introduction of yourself and of what you do, Dr. Dewan. And that'd be nice, and then we'll go to questions.
Great. Thank you so much for having me as a guest speaker today. I'm just extremely grateful for this opportunity to share some information with the community and to express our gratitude to you, Supervisor Cortese, and to the Board of Supervisors for all of your support of education. It is only through partnership and collaboration that we're able to meet the needs of our students and families in the county. And the level of collaboration and coordination we have is the highest it's ever been. And our children and families are benefiting, and I really attribute a great deal of that success to your leadership and your partnership. You know, the start of the school year is always a very highly anticipated time of year. Sometimes it induces anxiety, sometimes excitement, and a lot of energy. And many of the things that we would normally be doing, such as buying school supplies and visiting our doctors for wellness checks and things of that nature, have been disrupted. Before I get into some of those really important start of school announcements, I do want to share a little bit about what is a county superintendent of schools and what does our office do. So as the Santa Clara County Superintendent of Schools, I work with schools, communities, agencies, other partners to strengthen education and to provide resources and training and coordinate services and communication throughout the county. We lead a number of county-wide initiatives, and our services include training and professional development for educators, parent engagement, childcare and preschool, and emergency response and coordination. Really, since the beginning of COVID-19, the majority of our work has pivoted towards that emergency response work. And we've been doing this in a coordinated effort with the County of Santa Clara and in partnership with our schools. So we work alongside the County Emergency Operations Center and develop and disseminate information to schools, parents, and community groups and others. We've also been distributing personal protective equipment. So one of the things that we know has been a need and concern for schools is to have access to the PPE that will be needed. And we're also doing that for childcare centers. We've been supporting distance learning, distributing hands-on learning kits, coordinating school meals distribution, and as you mentioned already, working to close the digital divide. And I just want to take a moment to talk about the digital divide and how we had so many families and young children who were disengaged from learning in the spring. And, you know, it was such an enormous problem, and a problem that could not be solved by the schools alone. And when the county stepped up to really be a partner and to look at how the lack of access to the internet and to these devices also had health consequences, it really made a lot of sense for us to partner. And with the significant investment of the county, we're able to purchase devices, hotspots, and cover the connectivity issues and challenges for some of our most vulnerable children and families in the county. That's really important right now because we learned in mid-July that all of the schools in our county will be operating this school year in distance learning. And so we know that we can't go into the school year lacking that connectivity. So I also wanted just to share a little bit about how the school closures have impacted our children and families. Some, as we mentioned, don't have access to the technologies that they need. But there are also other consequences. You know, we're seeing that children are feeling some sense of social isolation, separation from their peers, and they're probably also experiencing some learning loss. Back in July, when the governor announced these new requirements for a county like ours, that meant that we were going to be starting the school year in distance learning and staying in distance learning until we're off the monitoring list for 14 consecutive days. So in a way, that's going to help our families kind of know what to expect for this school year. And we also know that this applies to all schools, public and private schools. There is one single exception to the prohibition for in-person instruction, and that is the ability for an elementary school to get a waiver. And we're in very close partnership with the county on this effort as well. And in fact, it's the local health officer that will grant the waiver to elementary schools who request it. And that waiver needs to be requested by the district superintendent or the equivalent leader in a charter school or private school. I think distance learning was a real challenge for our families in the spring and for our educators. People did heroic things kind of overnight, transitioning from in-person to distance. And I think there was a lot of frustration. So I also just wanted to share with the community that there are some new requirements this year for distance learning that will make it more rigorous, that will make expectations higher. And we really hope that our families will stay connected to their schools and understand that we're all learning this new world of distance learning, but they can expect a lot more from our schools this year. One of those things will be the requirement for daily live interaction, not just with the teacher, but also with the other students in the class. So I think that that's a pretty amazing shift in thinking from where we were in the spring. The last thing I really wanted to share as part of the introduction today, and then happy to take questions and just have a dialogue, is about health and wellness, and specifically reminding parents about the importance of immunizations. So even though we're not in in-person instruction, the requirements for immunizations remain. So and this is so important because over the years, even before COVID, the Centers for Disease Control and Prevention had been sharing data about how vaccinations prevent significant illness, and yet there were some outbreaks of measles and whooping cough in recent years. And that really speaks to the importance of that routine healthcare and that regular immunization. So when we don't have that, then we encounter these really extremely contagious and very serious diseases. So the best way families can help is to make sure that all of their children are on track for their immunizations this year. There's information available on shotsforschool.org, and be happy to share that website out to everyone. And just also, start of school, we're going to begin to see the flu season again. So the flu shots, getting those routine vaccinations, including your flu shot, is going to be really important to keep us healthy and safe. Checking in with the pediatrician for a wellness check. And then also, if your child hasn't been to the dentist in the last 6 to 9 months, it's a really good time to check in and get that routine dental care as well. So I think we can all have a healthy and safe school year if we're reminding each other that education and health go hand in hand. And it's going to take all of us doing our part to help keep our children well.
Well, thank you so much for that overview, and so much change, and we're starting to realize that some of it is permanent, or some of it we just at least need to treat as permanent because it's here long enough that it's impacting our children for perhaps a year or more at a time. Schools can't just turn on a dime and suddenly move from distance learning to classroom learning if things get better in a couple of weeks. So we realize that some of these things that you're asking parents and even the children to get used to are pretty significant changes, but they're changes that have been caused by this pandemic and changes that might be around for a while. We just don't know. So thank you for the job that you're doing. So we have Tara picking up questions today. Tara is here, and Janice is here from my office, and we have men out here running production, and Tebu Nguyen helps us with the show all the time, but we have a big space, so you can't see them. They are distanced, but you'll be able to hear Tara give us these questions that are coming in.
Yeah, so we have a question from Brenda. How will schools monitor Zoom classes? Will they be required to record classes?
Well, that is an excellent question. And many of their schools are using Zoom for some of that daily live interaction I mentioned earlier is now required. Generally speaking, the Zoom classes will not be recorded. There are some cases, however, where school districts have decided to record the Zoom classes in order to allow children who miss a class to be able to catch up and make up their instruction. But there aren't any requirements from the state or County Office of Education that they must be recorded.
And I assume, for parents' sake, the privacy laws under the protection of educational materials and student files and all that stuff would apply also to the Zoom recordings. So would it be true that parents wouldn't have to worry that those recordings would be distributed out somewhere else in the community without their child, without a waiver, their permission? Is that correct?
That is correct. And there's annual notifications that have to be provided to parents so that they know about that privacy and confidentiality. And so if a class is going to be recorded, the parents need to consent to that. And there have also been some trainings provided to the children and families about, if something's being recorded, that they may have times when it's appropriate to turn off their camera.
Sounds like everybody's thought that one out very well. Tara?
Yeah, so we have a question texted in. What important precautions need to be instituted before in-person instruction can safely commence?
Yeah, that's a great question too. Now let me just show my partial understanding. I know the county public health officer has talked about when that happens, to have cohorts of children that are staying in the same group for continuous periods of time. They are cohorts that are smaller, as I recall, than a typical classroom that we're used to from just a few months ago. But also, I'm sure embedded in that question is a lot of concern about what the understanding is of protocols coming in and out of the classroom, sanitization and all that kind of stuff. And I know you've put a document out yourself that's pretty extensive as a guideline for school districts. Maybe that's part of what you can talk about here.
Well, there is some very extensive guidance and guidelines for how to more safely operate school during COVID-19. So when we get to that place when we can do in-person instruction, parents can expect things like daily symptom checking for their child. They can expect that face coverings are going to be required, and that there'll be a lot of regular hand washing protocols that are going to be expected throughout the school day, as well as regular access to hand sanitizer when hand washing stations may not be as accessible. Some things like stable cohort that you mentioned will also be a part of how we think about operating school, as well as combining some virtual and in-person so that we can control the stability of the cohort a little bit better and still provide a continuous and really rich level of curriculum and instruction to students. There are some community-wide indicators, though, that I think may be important to speak to that will help us know when in-person instruction can be provided. One we alluded to earlier is that we'll need to be off the monitoring list for 14 consecutive days. There's some things like having regular contact tracing available. Robust testing is something that is an indicator that the state is looking at in terms of when in-person instruction can resume. And also just, as you mentioned, I think quite wisely, a lot of training for children, for families, for educators, and other school personnel on how to implement all these safety protocols.
Yeah, it's, I appreciate that overview or that explanation as well. There's no doubt that there's going to have to be a lot of new things implemented before we can bring kids in. And I've always raised the issue of if we have to have stable cohorts and they're only half or less the size of a normal classroom, where do we get all the classroom space in these school districts? So, but I appreciate you pointing out that these are state rules right now that are imposing the distance learning. It's not something that your office is imposing or that the county public health is imposing. It's basically the governor saying, not right now, you're going to have to be off that watch list for 14 days. So, Tara?
Yeah, so we have a question texted in.
And the texter says, "Hello, I hope you're safe. I wanted to ask if there are any specific ways or programs in place for individuals to volunteer with the schools in our area. I want to help ensure education reaches people in our county."
Wow, what a great question. And I'm almost feeling like if we don't have that, we should start it, a volunteer pool. What's the real answer to the question, Dr. DeWine?
Well, I do think that it's a challenging time for schools in terms of volunteers, because all the ways that we used to be able to welcome volunteers to school sites, serve on committees, and do other things don't really exist right now. And so I think connecting into the school site with the principal, the parent-teacher associations at the schools, and also there are a number of community-based organizations that are welcoming volunteers to assist with things like meal distribution, distribution of devices, and things of that nature. I think our schools are also still in need of resources, and some of those resources could be things like expertise. They could also be things like unused devices that could be repurposed, and they could also be things like access to school supplies and materials that a child might need.
Yeah, I know that a lot of the science fair type projects are still going on.
Yes.
In cohorts that are external, or they're bringing kids in through Zoom with a parent leader, for example. I've seen that. I've been invited to some of those, but I sat there and I wondered, with some of the families, I wonder if they need help, with the supplies, the little ingredients that you use to make a science project. So maybe that's something we can work on together, is to try to figure out where folks that are at home that may have the experience, maybe they've been tutors, maybe they've run after school centers in the good old days when we had physical after school centers. Maybe there's a way for us to promote some of that in virtual time. It seems like it might actually be cheaper to do it that way. And I know we'd have to do that with the cooperation of our teachers and our school employees, but it's probably worth talking about.
Yeah.
So we have a question texted in.
They mentioned they see new cases of COVID in the county, and their question is, how can we slow the spread to go back into the classroom? And where are the cases coming from so we can all do our part to slow the spread?
Yeah, the answers to where the cases are coming from are coming in more clearly now than ever before for a couple of reasons. One, we've required a lot more transparency. That's an area where the Board of Supervisors, including yours truly, has been very adamant that we want to know zip codes, for example. We've asked for census tract information. It's not because we want to stigmatize those communities. It's for two reasons. One, if there are communities that are hit hard or they're overrepresented, then we should be over-resourcing them. We should be going in there to try to slow the virus down more, to do whatever we need to do in terms of resources in those communities. And we are. We've just approved a couple $1 million from the county budget recently to do that outreach work. And I know the county office is involved in that kind of work as well. But right now, until we have a vaccine and Federal Drug Administration approval on a vaccine or antibody testing, it's really, I think, the answers that we're hearing from all the experts that we feel compelled to listen to is that we have to continue to use the PPEs. We have to have really good systems like stable cohorts, meaning don't mix groups together and then lose track of who infected whom. And you'll see, for example, when we opened up construction in May, they kept those sites very insular. They minimized the amount of time that groups could mingle together or interact together. And then robust contact tracing, you mentioned that earlier. The county now, according to Dr. Rudman, who was here a couple weeks ago on the show, has over 1,000 contact tracers. So there's really no reason if we do get to that point where we can open up schools and then a cluster breaks out, there's really no reason now that we can't trace back where did that come from, which family was exposed, maybe is there something going on that we need to minimize or or reduce the incidence of. And for now, those are really the tools that we have. And I don't know if there's more that you can think of. I saw a robot a few days ago that goes around, it maps the room. You might need this for the school someday.
Okay.
And then in between, when groups come in and out, it goes around and anything that was touched by anybody, it sanitizes it automatically, and then it stops. And every time someone touches a doorknob or a desk or something, it goes and sanitizes that with peroxide, basically. So we may start seeing some of those kind of permanent changes in the future. Anything else you wanted to add on that one?
I would like to just add that the things that we know that slow the spread are simple things that we can all do. And that includes wearing our face coverings, washing our hands, social distancing or physically distancing, having stable cohorts and things of that nature. And one of the things that we've been learning is that some of the spread is attributed to the times that we spend with people we know well. And so, for example, we may have a family gathering or a special holiday event or something, a community or neighborhood party. And because they're our neighbors or our family members or people that we know, we may not think that it's as important to still wash our hands frequently, to still wear a face covering, and to socially distance. And so some of the best things that we can do is to be really vigilant in all of our settings, that if it's not the member of our household or they're not in our stable cohort, we need to do those kinds of precautions.
Good point.
Yeah, so a question texted in.
What are the plans for high school students as far as SATs and AP testing is concerned, and how will schools conduct testing in general?
Well, there are a number of things happening in this area, Supervisor. One is that we don't believe currently that SAT and ACT can be offered. especially not in person, and there isn't currently a provision for those tests to be provided, only virtually.
Can I interrupt? I heard that the UC, was it the UC system that dropped the requirement for now? I don't know if
Yes.
that was COVID related or some other philosophy, but maybe
Yeah.
parents don't have to worry about it as much right now. Is that part of it?
Well, there are certain schools, certain universities that have waived that requirement or dropped it entirely, and there are others who, have maintained that. If we find that we are able to provide the SAT and ACT, it's going to have to be done in a way where it's conducted outdoors. That we're not in a place yet where we can bring groups in person for those types of activities. With regard to the AP testing, however, there are some opportunities more for virtual ability to offer those tests virtually. And then a number of the other kinds of state required tests, there are some that require in person, and we are awaiting specific guidance from the state, but we think that some of those will be permitted in very small groups or in one-to-one with the right PPE.
Great. Well, we'll keep everyone posted. That's good information, Janice and Tara, for us to try to get out as things develop during the school year, because I know, having parented 4 children that went on to college, it gets around junior year where people start getting nervous about when those deadlines are and what the requirements are and how to do it. So we'll get that. We'll help you get that information out. Tara.
So this question is from
Mary, what resources and services are available to support youth well-being, mental health promotion, and suicide prevention? What role is the County Office of Education taking to support students, educators, and parents?
Well, certainly the county itself has a huge behavioral health department, but I think the question in this case is, how do you incorporate those kind of services? You and I have worked for a few years now on taking Mental Health Services Act money and funneling it into something that we call school-linked services, so that there's clinical services available at our schools, but now the kids aren't in the schools. I know that the coordinators for those behavioral health programs in the schools are working remotely. But how does that look? And you're doing special ed and other direct educational activities through the county office. How do you work in the behavioral health part of it?
Well, social and emotional wellness is really key right now. As I mentioned earlier, a lot of trauma and social isolation that children are experiencing. There are hotline numbers that are still operating. A lot of the counseling services and crisis services are still available. They've just shifted to like telehealth or telecounseling. Yes, and our schooling services program is still operating quite robustly. And in fact, a number of families reported on a recent survey that they are benefiting from these online or virtual offerings. And even when we are going to be able to shift back to in-person, they would like to see a hybrid or a continuation of the virtual and telehealth offerings. There's also a hotline or helpline number. I think it would be great to share this number. And it's the California Parent and Youth Helpline phone number. And it's a place where families can go to get information during COVID-19. About resources and get referrals to services that they may need. And that number is 855-427-2736. And I would also just share, another initiative that we're working on. It's not quite up and running yet, and it's in direct support to school-linked services, is a new grant that we've received that we'll be working on with the county and the Behavioral Health Services Department to expand access to school-based counselors and to create some preventative wellness centers on school sites. So more to come in the future on that work. And then lastly, we have a warm line phone number. It's supported through our Inclusion Collaborative, and it's a phone number that parents can call to get information, and we offer this in multiple languages. The phone number is 408-453-6651. And this just really robust offering of support, individualized planning, help with special ed if needed, as well as just like maybe how do you set up a routine at home if you're doing homeschooling or distance learning. How do I help my child have a regular routine day? So lots of supports available through the county office.
Those are great numbers. We'll get those in our COVID update that we send out by email, which tens of thousands of people are receiving that now through my office. So if you can see our number on the screen, feel free to call in, give your email address if you want Janice Rombeck from our office to forward those daily updates to you. You can always opt out later, obviously, when you don't need them anymore, when COVID goes away. But these are the kind of phone numbers and information that you get because these folks do such a great job of getting that kind of information out. Again, I want to remind that who we're talking to here today is Dr. Marianne Dewan from the County Office of Education. That is a separate agency from the County of Santa Clara. We have a similar name, County Office of Education, County Board of Supervisors, but she has her own board of directors that are elected, and we thank them for all the hard work that they're doing and for allowing you to be here today, supporting your efforts. And the County Office of Education is really doing a great job in so many areas that we've had a chance to talk about today, taking the responsibility to make sure that they're front and center helping families during COVID-19. Yes, Tara.
Yeah, so I know you
Addressed this earlier, but it's a great question. John asks, how is the county addressing inequitable access to internet and electronic devices so that all students can participate in distance learning?
Okay, so we just wrote a big check that on the one hand was hard to write because we have diminishing returns right now, but on the other hand was very easy for me to recommend to my colleagues. And to the credit of the Board of Supervisors, the board unanimously agreed to invest $7.1 million in making sure that there aren't gaps out there. But maybe one more time you can just give the short answer. We talked about it earlier about what you're doing procurement already. Before we started the show today, we were talking about all the progress you're making closing the digital divide.
Well, we're really, again, just so delighted to have that support. The needs are urgent, and schools do not have the resources and capacity to solve this problem alone. And because we share a lot of the responsibility for so many children and families, and we recognize that that lack of connectivity to the internet is also a health issue, this investment is going to go a long way to crossing the digital divide and that urgent need. So through your leadership, the $7.1 million is being used to purchase devices, mostly Chromebooks, for students, and it's to try to help us get to that one-to-one device closure. Children can't share a device with their siblings and participate in live instruction throughout a school day. So each child, having that access. And then additionally, we know that there are issues with connectivity, just getting onto the internet, whether that's infrastructure or lack of broadband or inability to cover the cost of an internet service provider. So these resources are going to be used to purchase hotspots, to cover connectivity gaps, and to help problem solve for that connection that a family might need.
Well, thank you very much for that and in that overview. Again, I think the thing that was most compelling to me, and we're never frivolous about writing a check for $7.1 million, but for the state of California to say, go home and distance learn, that's fine. But it's not fine when they make that mandate and there's 15,000 kids out there in our own community who have no way to hook up. There's no way to hook up. That is something that we've seen over the years. We actually read about it in history books now, how communities have been marginalized and they're pushed back and they're set back and kind of their learning or their stature in life is suppressed, repressed and suppressed and oppressed for years and years because decisions like that were made not to invest. So we invested. I put my mask back on because of two reasons. One, it cooled down a little bit in here. We were running at about 97 degrees, I think, and the other reason is because I'm surrounded by women who all have their masks on, and it finally occurred to me that yes, men are always weaker. I had to take mine off because of the heat, and they just keep plugging away here with their masks on because women are so strong. So good for all of you. Dara.
Yeah, so you mentioned
Training for parents earlier. So someone on Facebook wants to know how you're offering trainings for parents over Zoom or Google Hangout, and will it be offered in different languages?
There are so many resources available for parents and in normal times, and obviously, yes, we've had to transition to virtual offerings for parent training and parent engagement as well. Some of those have been through Zoom and WebEx, and many have been kind of live chats. So we've created these opportunities sometimes with partners like Parents Helping Parents, and through our Inclusion Collaborative as well, to have chat sessions where parents can engage with each other around the challenges of distance learning or trying to navigate the system of special education or learn about COVID-19. So we'll share the website and phone number, and we can include that in the newsletter. But those are continuing to happen. Again, some are live with engagement and some are webinars and other forums that are being provided virtually. And there's also information on our website, and I'll share our website information too.
What are you hearing from teachers? I have a son who's a private school 8th grade teacher, and I have a wife, Patty, who's a school board member, and she's a substitute teacher. And the challenges for the teachers themselves, not only those who are worried about interacting with each other, you know, with the pandemic, but distance learning, it's a whole different thing. And I know they want to keep the kids accountable and try to help make sure they're getting the work done. Do you hear a lot of angst or concern coming in? I mean, this has got to be a difficult thing to adapt to.
I just have to give a huge shout out to our educators. You know, they are amazing. I think very heroic in their efforts to, just like all of us, overnight change the way that we do our work. And they did it with such empathy for the experience for children and families. And often we're doing it without all of the resources that they might have had in the classroom. So our teachers, you know, they're pretty heroic in this work. I would also say that our teachers engaged in a lot of training over the summer, used their time to learn more about how to do distance learning well and to get access to new resources. And our teachers want to be back with their students. You know, I hear from them all the time how much they miss that in-person instruction, but they're really rallying to this requirement for distance learning. I think the other thing teachers would say is they don't want their students to spend all of their time on the computer. So we've got to do it during the school day. You've got to do your lessons. You've got to do your homework. But let's do some of these assignments in ways that are more engaging as well, like hands-on activities, science experiments, like you mentioned earlier, and get outdoors. Take some time during the day to get some fresh air, go for a walk, do some things like that. And so a lot of our teachers are trying to model that in the way that they are living their lives during distance learning. And our teachers, I hope, are feeling supported by our community and are also engaging in some wellness activities for themselves. Our teachers are parents too. You know, many of them have their own children at home, so they're doing what many of us are doing.
Dr. Marianne Dewan, that was a great answer to that question, in my opinion. Thank you.
Yeah, and this is probably
Our last question, and it's texted in, and they mention a situation in Cherokee County, Georgia, in which 2 high schools were forced to close, and it led to the quarantine of hundreds of students and staff members, and they're asking, what can we learn from this experience?
I would say not to rush, and you can imagine, I'm sure you get the emails. We get about 10,000 emails a month, and that's really not an exaggeration. from people of all different persuasions, but we have an awful lot of people who just simply say very short, blunt things like open up the schools now. Just open them up. Just do it. And, I think I know what your persuasion is on that, but why is that not such a good idea? Are these examples of what can go wrong?
I mean, obviously, we highly value in-person instruction. I mean, that's what we all want and value for our children, and schools are central to our communities, and we understand that. We do want schools to reopen to in-person instruction, but we need to do it when the time is right. We need to do it when we have the resources that are necessary. And we need to do it in a way that's going to protect the health and safety and wellness of our children and our educators. We've also learned lessons from across the country and across the globe about some ways in which in-person instruction can be delivered safely. And so maybe the lessons to be learned are from those places where some success has occurred.
And you have been studying those. I was going to ask you that earlier. It sounds like you're paying attention to best practices, not just here or state by state, but all over the world. That's great to hear. Well, Tara, we have a few more minutes left. I want to give Dr. Dewan an opportunity to, to say a few words about whatever you want to talk about, and what can we tell people about the hopefulness, I guess, of the future. I could say all kinds of more complex things. We have, how many school districts do we have now in the county?
We have 31 school districts. We have about 400 plus schools across the county. We have some teeny tiny school districts, I like to call them, where they have fewer than 100 students, and we have some of the largest school districts in the state and our county.
And all of those districts, I think all of them have their own school boards, and if and when the governor says you're no longer on the watch list for 14 days, then they will all make somewhat individual decisions about opening up, and you'll be there to guide them on what they need to do as minimums before they open, as I understand it. Well, maybe you can just talk to our viewers and let them know what you see as hopeful about going forward. We've made it 5 months into this shelter in place, and I think people are eager to hear that this is all going to pay off, and we're going to have good things happening at some point in the future.
Well, I do have a lot of hope for the future, and I love education because every year we get a fresh start. The start of a new school year has always been such a positive, energizing time, and I think that's even true this year. I had the opportunity to hear from students. I was talking to some high school students about the things that they miss or that are different about school than what they had expected. And when they were sharing their experiences, what they really talked about was needing that connection, that connection to learning, of course, but the connection to their peers and to their teacher. And I think that the hope of what our schools do for our community is really key, and it's going to help us get through this pandemic in some really powerful ways. I also would just send the message of stay connected. We may have this tendency to stay alone or stay by ourselves and not reach out. Maybe we don't want to watch the news as much as we used to, for example. But really stay connected to the schools, to your child's teacher, to the principal, and if you need some things, ask for them. I think that there's a strong eagerness and willingness for us to all come together to support each other through the pandemic.
I couldn't agree more, and thank you for those inspiring words and positive words as the true leader that you are. Dr. Marianne Dewan, thank you so much for being here. We hope the pandemic's over before we need to have you back again, but we're going to reserve our right to bring you back if we need to, because this has been really great and informative, and I'm sure especially folks that have kids in the schools have appreciated an ability to hear directly from you. Thank you
I'd
so
be happy
much.
to come back anytime. Thank you for having me.
Thank you. We'll see you all next week, everyone.